To better detect the more subtle diastolic murmurs of aortic regurgitation and mitral stenosis, you should routinely use two maneuvers. The first maneuver is performed with the patient sitting up and leaning forward.
Way forward. Big breath in, blow it out, and hold it out.
Ask the patient to exhale completely and hold his breath out. Using the diaphragm of the stethoscope, listen at the left second interspace and down the left sternal border to the apex for the high-pitched, soft-blowing, decrescendo diastolic murmur of aortic regurgitation.
Take a breath in.
Pause periodically to allow the patient to breathe. If the patient had this murmur, it would sound like this. The second maneuver for auscultating murmurs is to have the patient change to the left lateral decubitus position, as demonstrated earlier when auscultating heart sounds. This position enhances detection of the more subtle opening snap and diastolic rumble of mitral stenosis.